Hi, if you remember a couple of videos ago, we started a series on the management of dental trauma. We already covered the first topic, which was the first questions to ask. Today, we will talk about the clinical examination. First, we need to check if there are any swellings, bruises, and lacerations. Then, we can go ahead and palpate the bony contours and the borders of the face for any steps. If the cheekbone is flattened, this might mean there's a fracture. Also, we need to check the soft tissues for any foreign bodies and the extent of the mouth opening, also if there's any pain. Then we can move intraorally and we check for any injuries. We need to also see if there's any bruising, which could mean that there's a fracture. We can also check for the missing or broken or displaced teeth and the patient's bite. Now, should you do pulp testing? You can, but the results are not going to be accurate. So the best thing is to monitor for change over time. You do need to take radiographs though. You might see widening of the periodontal ligament, which indicates displacement of the root tip. If the periodontal ligament is lost though, this means intrusion. If the periodontal ligament is interrupted or there's a change in the direction, this means there's a root fracture. Now, when should you refer to a maxillofacial surgeon? If there's numbness or changed sensation in the face, if the patient has lost facial muscle control, if there's asymmetry in the face, if there are deep cuts or uncontrollable bleeding, if the patient cannot open.